Hi, everybody. Welcome back to What's Up Wednesday. My name is Rachel, and I'm on the client success team here at Early Learning Ventures. And today I am joined by Tracy with the Colorado School of Public Health Culture of Wellness program. Welcome, Tracy. Thank you so much for joining us today.
Thank you for having me, Rachel. Looking forward to it.
Yeah, me too. Thank you also to everybody who is joining us live today. If you have not heard of Early Learning Ventures before, we are a 501c3 nonprofit based out of Colorado, and our mission is to expand access to quality and affordable childcare. Be sure to check out the description of this video where you can find links to all of the resources that we offer, as well as the link to the Culture of Wellness program so you can learn more afterwards. And if you have any questions come up today while we're live, please add them to the comments. We would love to just, if you say hello or if you have questions about what we're talking about, we'd love to try to get to answer those while we have Tracy here with us today. And then we also have a giveaway announcement. We are hosting a giveaway for a $20 Kroger gift card. So to be entered to win, we're just asking that you add a comment to our What's Up Wednesday videos and share some back to school tips and tricks. We encourage you to join each week to enter. This is a 7-week-long giveaway, so you do have lots of opportunities to enter, and we would love to hear those back-to-school tips and tricks. I'm also going to add these giveaway details in the comments here in Spanish. All right, let's get started. Tracy, what is up on this Wednesday? Can you start us off by introducing yourself and tell us a bit about your role at Colorado School of Public Health?
Sure. So yes, as Rachel mentioned, I'm Tracy Doig. I'm a program director over at the Culture of Wellness in Preschools. I specifically manage 2 grants, the Healthy Food for Denver Kids grant that we manage, and then also Denver Great Kids Head Start, which is a delegate agency that oversees 6 different agencies. So we do programming within them. And I have been with the Rocky Mountain Prevention Research Center, which is within the School of Public Health, for 12 years, going into year 13. I was very fortunate enough to be on the planning team to help design, develop, and implement the first programming that we started. And previous to that, I've been in the industry over 30 years, so I've kind of been in different roles. I was with the Office of Head Start. I've been a Head Start director, done some training and technical assistance, and I've actually owned and operated my own childcare centers before as well.
Awesome. Thank you, Tracy. And then we had Diane and Brittany from Colorado School of Public Health with us last week as well. And your guys' programs are very closely related, right?
Absolutely. Yeah, they went on and developed a really wonderful wellness initiative that really supports employees that work in early child care and education. And they're in some of our programs that we started with at the beginning. So it's nice to see new programs implemented.
Yeah, that's really exciting. So can you give us a brief description of the Culture of Wellness program that we'll be sharing about today and talk about the main objectives?
Sure, absolutely. So the Culture of Wellness was, it's basically an evidence-based program. We started off with using the curriculum called Integrated Nutrition Education Program, which has been around for over 30 years. And we adapted that to make it more appropriate for the early childhood education ages. So we primarily started with 3 to 5-year-olds in preschool. Since then, we have added toddlers, and then we have expanded into all the way up to 5th grade and kind of merged our programs. So literally, it's called the School Wellness Program for all the grades, but the one we're talking about today is specifically for the preschool age group. What we do is we basically are a strength-based program. We focus on different areas such as child focus and adult focus. And for child focus, we talk about healthy eating and active living. We provide nutrition education lessons that come into the classroom. I can get into that a little bit more. And then they get to bring food home and they get to share it with their family members at home if they're in a FFN group. Or if they're in an ECE, they get to do this group lesson in a story time, in a small center, or whatever's appropriate for that age group. And then it goes hand in hand. When you're eating healthy, you really want to be more physically active. So we do a lot of physical activity lessons, music, movement, anything to get the provider, the classroom, the parents, the volunteers, anyone that's in the environment up and moving and increase their steps throughout the day. In addition to that, we do our adult-focused programs, which are workplace wellness workshops. We do a Text to Live Healthy texting platform. And then we tie it all up with a policy system and environment change process. That's a lot of words and a big word, but basically you're assessing where you're at. You're identifying new things you'd like to do. And then you're coming up with a plan. Let's make it happen. And we work with providers in licensed ECE centers and with family, friend, and neighbors who are providing a much needed service to neighbors, friends, family, and that type of support network. One thing I do want to share, we can go into a little bit more about that, but one thing I want to share is that we are now, I just found this out, we're in over 14 counties. We have provided service to over 50,000 families, providers, children, and we are in over 150 schools. So we're not just Denver based, we are located in the San Luis Valley, Weld County, Grand Junction, Pueblo, Colorado Springs, and then throughout the Denver metro area.
That's amazing. I love to hear those statistics and numbers like that. Thank you so much for sharing.
Sure, absolutely.
I love also that the program is incorporating everyone who's involved in the child's life. That's really awesome.
Yeah, thank you.
Yeah. So can you explain the importance of this initiative in the family, friend, and neighbors community specifically?
Absolutely. So it's not new to anyone in early childhood education. They're really our first and foremost providers of care. So how many of you remember growing up and you're like, oh, we're going over to Auntie, we're going over to Tia's house, and we're going to go over there and be with the cousins, because a lot of your cousins are your first friends as well. So really, family, friend, and neighbors are such an important audience and providers and a caregiver group. So what we've done is we've adapted our programming really to meet the needs of that group, because it's different than an ECE environment in a facility with multiple people around. It's more in a home environment where you are there with your children and additional members of neighbors that come over. So what we adapted our programming is we've always had English and Spanish, but Ethan, who's my partner who wasn't able to join us today, adapted it into different languages. And we're really proud to announce that we've done Dari and Arabic. So we have adapted all of our lessons, our nutrition education, our parent engagement opportunities, our wellness workshops. And how we did that really was is recruiting people from the community to be on a steering committee. We had an advisory team, and Ethan led the charge with meeting with them weekly, bringing back our documents. How does this work? What can we change? What's appropriate? What's not? What I really like about involving the community is we had their voices heard, and we adapted things instantly. We became more culturally relevant and added more culturally diverse foods and things that were more appropriate for the home environment as well. In addition to that, they get a kitchen kit. So literally they get to go, who doesn't love to go home with goodies and a bag of, new items? So they get to go home with new muffin tins and cutting boards and colanders and knives and apple cores and choppers, food choppers, everything that you maybe is not on your priority list for a kitchen, we give them, so we making the recipes really easy and user-friendly at home. I think a couple other things with the family, friend, and neighbor group is that we're having these wellness workshops in locations that meet their needs in the communities that they're in. So for example, we have held these in churches, community centers, most recently mosques, and we've also partnered with Denver Parks and Rec, and we've been in recreation centers as well.
Wow. What an incredible resource. I love the different language options. And I know you mentioned Ethan was supposed to be here with us today. Really sorry that we couldn't have him. I hope that we can do another follow-up episode to talk more about that. So that's incredible.
Absolutely. Always give a shout out. He's been a fantastic colleague and really has helped grow this program. He really is really well versed with the immigrant and refugee community and has been really helpful with this project.
Yeah. And thank you for explaining the sort of the difference there from the family, friend, and neighbors community for someone who may not be familiar.
Sure, absolutely. And on that note, we are recruiting. So we're recruiting for the fall program for our Denver-based grant, which is the one that is sponsored from Healthy Food for Denver Kids. The only caveat is you do have to be in the Denver location. And so that is one area that we have openings for English, Spanish, Dari, and Arabic. And we haven't posted the locations yet, but if you are interested, Rachel, I'm sure we'll refer you to our resources at the end, but that's what we're really looking to expand. And then we also did just apply for additional funding through the wonderful Colorado statewide Parent Coalition grant to expand in 3 different areas. So we're looking to grow in Aurora, We're looking to grow in Weld County, Greeley area, and certain areas of Jefferson County as well. So we're keeping our fingers crossed that we will receive additional funding to serve those areas.
Yeah, that's really exciting. I'm going to keep my fingers crossed for you as well. Maybe anyone who's watching, if you know anyone in these communities or in these areas, you can share this video. And if you have any questions, you can reach out to me. I can help point you in the right direction. And we do have the resources in the description of this video as well.
Wonderful. Thank you, Rachel.
Yeah, Tracy, can you talk about the parent education workshops? How do these support families in creating a healthy home environment?
Absolutely. So that is really my passion, is just how can we make things simplified, easy to do, hands-on, adaptable for, you might have one child, you might have two with some differing needs, and you might have two that join after school. So how can we make that work? So with our parent education workshops, we literally model, mentor, and we do a lesson, like an activity during that workshop. And while we're doing that, we didn't realize the impact we had on building the community. So these family, friend, and neighbors are joining us, and there could be a cohort. Our original one was between 15 and 20 showed up every week. It was a 6-session series, and so pretty much people showed up pretty faithfully and came to every session. How we keep them engaged is by giving them different incentives to go home with their food. So after they learn what they're doing in the workshop, then they get to go home with a lesson summary that explains how to do the cooking activity, how to get the children involved. So children will be involved with the washing of the fresh fruits and vegetables, using a colander to rinse, and then actually using child-friendly knives to help cut the fruits and vegetables for each activity. And I think that's where we see the growth at home, is that parents are giving their children, per se, permission to be in the kitchen and to help prepare and set a table or set an area where they're maybe eating with multiple families, and really adapting to their needs. We've seen an increase in knowledge about food. We have 6 different topics that we talk about. It ranges anywhere from staying active to reducing screen time, to helping children try new foods. We have one on basically eating more fruits and vegetables with your main meals, but also snacks. And so the topics range widely, but then they also get to take home an incentive. So it might just be as simple as a lime juicer. So you can use fresh limes and lemons for dressing instead of choosing some alternative, possibly unhealthier salad dressings. So literally, and the feedback we get is like they get excited to come back. We give them muffin tins to make like applesauce muffins at home with our apples lesson. We always start with germs and hand washing because we want to make sure that the kids are understanding the importance of, being prepared and working with food and keeping those germs away as well.
Yeah, I know it's like kids want to help, but sometimes that can be intimidating if you don't know how to teach them how to help, and you're giving them all the tools and resources for that and making it fun and exciting for everybody involved. I love it.
Yeah, who doesn't love that? Rachel, I'd like to do a cooking class with adults, but I need to put that in my schedule.
That's what I'm thinking. Like, I want to join. That's awesome. So you mentioned the Text to Live Healthy program. Can you tell us a bit more about that and how it complements these parent education workshops?
Sure. Yeah. Our Text to Live Healthy program has been very robust and very evolving as well. So it started off with sending home, simple messages about resources within your area. You'll get anything from a 5-ingredient or less recipe to make on your way home from work, maybe stopping in and getting those ingredients. We can connect to local resources. So if you're located in the San Luis Valley or Greeley, we can find out like what food markets are going on in the summer, what resources are available for health and wellness, and really cater to those specific areas as well. We can send links to our sessions. We can send links to our parent wellness workshops. We can really just cater it to what resources are needed in the area. And we do work with other agencies if they have a message. We've worked, we are funded through Culture of Wellness through SNAP Ed funding. So we'll refer to My Plate resources, existing things that we don't have to reinvent the wheel. And the feedback we get from parents and families is, wow, it comes to my phone. Everyone typically has a phone and they have that with them throughout the day. So those messages are, they come anywhere from 3 to 5. I think that's more than that. Ethan knows those numbers, those statistics, but there's quite a few of them that come. And if at any time you don't want them, you can just disenroll, and there's no, we're finding that they're very helpful for people, that most people stay within and want to receive them. So
Yeah, that's great. Very easily accessible too.
yep, absolutely.
We have Joalba in the comments saying that she loves this and would love to join to help her daughter be able to eat better and learn how to involve her in the process.
Oh, wonderful. Oh,
Yeah,
well,
thanks for
reach
sharing.
out to us. We'd love to talk more with you.
Yeah. So, how have you ensured that the Text to Live Healthy program is accessible and effective in diverse communities?
Sure. So I think just changing the platform, we have a Text to Live Healthy team. Beth and Ethan and some other team members are on it that actually write the messages. They make sure that they're appropriate for the communities. They make sure that they are accessible. We're meeting all the new requirements within the university. Being a part of the Rocky Mountain Prevention Research Center, we are up to date with, most current trends and resources, and also requirements for legibility and making sure that our messages are simple, and we can also tell how often they're being opened and how long people stay within the program. And so we're able to have a lot of data and research to grow our Text to Live Healthy platform, which enables us to get better. Everyone wants to do better at what they do, and so it's always evolving, and we have different platforms for different groups and areas, so we can really see what's working in that community and learn for another community as well. The Dari and Arabic community, I think that's one thing. We've been using WhatsApp texting platform with them so that they can continue their group. So I was mentioning earlier about the community of learners. This cohort of learners really has been such an amazing thing to see, from workshop 1 to workshop 6. And then they keep that WhatsApp stream so they can connect and talk about recipes and sharing different resources in the communities. So I think that's one of the unintended benefits of our programming as well.
Yeah, that sounds like an amazing benefit, bringing everyone together, even, continuing on afterwards.
Absolutely.
So, how can other providers or centers, or maybe somebody who's watching, join the program if they're interested?
Sure. Yeah. So we do have our main website that you can send a message through there. Our other program director, Deanna LaFlamme, she receives those messages. She'll notify me. And then if you're interested in the family, friend, and neighbors, you can reach out directly to me or Ethan. And literally our emails I think will be posted in there where you can reach us. If not, I can put it in the chat. And just send us a message, and we'll see if you're able to join us under different grants and funding. And cross our fingers, if we get additional funding, we'll know, and we will start those new locations in November, provided funding gets approved. So
Great. Yeah, let's all keep our fingers crossed for that.
Mhm.
I did put the link to the main website in the comments here as well. And then I do have your contact information, both of your guys' contact information, and the link to the website in the description of the video.
Fantastic. Gotcha.
Yeah,
You got us covered, Rachel.
yes. Well, thank you so much, Tracy. Do you have any final thoughts to leave us with today?
No, just thank you all. And I just want to thank providers everywhere across, not just Colorado, but just how wonderful and the work you do. It's the passion, the love and care you put into it. I mean, I wouldn't stay in this industry for over 30 years if it wasn't for all the providers out there. So thank you for what you do every day. And Rachel, thank you guys for the platform, for being able to share what we're doing out there.
Well, thank you, Tracy. I really appreciate you joining us today to share. And that was a lovely final thought. That was great. Thank you so much for everybody who's watching. Thanks for joining us today. I hope you all have a good rest of your day, and we'll see you next time. Bye.
Bye. Thank you.